everyone. A very good morning to all of you. Let me confirm if I'm clearly visible, audible. I will start the class ahead. Give me a minute to confirm it. So I welcome you all for today's session. A very good morning to all of you. I am Dr. Priyanka Sachdev here, and today I am here to take my series that is Super Simplified Pathology. In this series, I'm going to cover entire pathology from Robbins in a simplified manner. So today, my topic for teaching is one of the best topic, one of the most difficult topic from general pathology, that is hemodynamics. So we have already started hemodynamics, studying hemodynamics, right? In hemodynamics, these are all important topics that we have to cover at MBBS level for competitive exams as well as university exams of second prof MBBS in pathology. We have already covered edema. We have already covered thrombosis. We have already covered embolism in the last lectures. Those who have missed it, they must watch the recordings of all these. It is available on the YouTube. Now, in this lecture, I am going to cover hyperemia and congestion. Basically, I am going to cover congestion, that is chronic venous congestion of the three organs, liver, spleen, and lung. Liver, spleen, and lung. The three organs congestion, CVC, lung, or CPC, lung, liver, and spleen, I am going to cover. Right. So, without wasting time, I am coming directly on the topic. Before starting it, you should understand the differences between hyperemia and congestion. What do you mean by hyperemia and what do you mean by congestion? For that, I would like to draw a diagram for you, right? So listen, you can see there is an organ. Can you see here is an organ? So there is an organ here. Can you see this is the artery of this organ supplying blood, supplying pure blood to this organ. Of course, it is supplying pure blood to the organ. Can you see here is a vein? The vein is carrying the impure blood away from the organ. So see the direction. Artery is giving pure blood to the organ. Vein is carrying impure blood away from the organ. So this is the blood supply of this organ. It can be any organ of human body. Imagine two conditions one by one. Imagine a condition in which the artery undergo vasodilation. So what will happen? Because the artery will undergo vasodilation, more blood will come. So organ will receive more of the pure blood. This condition is known as hyperemia. Hyperemia. Hyper means more, emia means blood. That is more blood, but more of the blood is pure. That's why the organ will look red in color. That is known as erythema. So organ is erythematous. Organ is erythematous because of more of the pure blood inside the organ, and the condition is known as hyperemia. Imagine other condition, the other way around. Instead of dilating the artery, I'm obstructing the vein. So the venous drainage got obstructed. There is obstructed or impairment in the venous drainage. So venous drainage either impaired or obstructed. What will happen? So the impure blood cannot exit out of the organ. So again the organ will have more blood, but this time this is known as congestion. This is known as congestion. Again the organ have more blood, but this time the more blood is impure. That's why the organ look blue in color, and it is known as cyanosis. Cyanosis. Have you got it? So what is the basic difference between hyperemia and congestion? So in short, in hyperemia as well in congestion, there is more blood inside the organ. But in hyperemia, the blood is more. That is the pure blood. That's why organ is red or erythromatous in appearance. And it is an active process because hyperemia involves dilatation of the artery. For doing vasodilation, ATP is consumed and it is an active process. It is an active process, right? And come on the congestion. Here we are doing obstruction of the vein. So that is a passive process. It doesn't require energy, it doesn't require ATP. So it is a passive process, right? Again, due to the vein is congested, the vein is obstructed. Again, the organ have more blood because the impure blood cannot leave the organ, and there is more of the impure blood inside the organ. So again, more blood inside the organ. This is known as congestion, but this time the blood is impure. That's why the organ will look blue in color, and this is known as cyanosis. So my summary is that the two things, that is hyperemia and congestion. Hyper means more, emia means blood, and congestion. These are the two terms, both of which the meaning is same. Increased blood, volume of blood in the organ, increased volume of blood in the organ. It is due to vasodilation of artery. It is due to impairment or obstruction in vein. That is the reason. The reason for the two is differing. Please mind it. Here pure blood will gather. That's why the organ look red in color. That's why it is known as erythema. Here impure blood will get gathered inside the organ. That's why the organ will look blue in color. And this is known as cyanosis. Right. This one is the active process because it requires vasodilatation of the artery. That is an active process, and this one is a passive process. For doing obstruction, no ATP is required. So that is the differences. Now read it. What is hyperemia? What is congestion? I've already explained you the basic concept. Both, the meaning of the both is same. That is localized increased in volume of blood within the organ or the tissue, increased volume of blood. So that is the common definition for both. So you can see either dilate the artery or obstruct the vein. In both ways you are increasing the blood inside the organ. So let's come on hyperemia. In hyperemia, I've already told you it is due to dilatation of the artery. It is an active process. Here the organ looks red in color, that is erythema, because of increased delivery of the oxygenated blood. Oxygenated blood is pure blood. You got it? What are the examples of hyperemia? When does hyperemia takes place in human body? That is, when does vasodilatation of the artery takes place in human body? So the best example is inflammation. Whenever we have inflammation at any part of the body, so vasodilatation of the arteries takes place and the inflamed organ is red in color. You know the 5 cardinal signs of acute inflammation? You may be knowing. In inflammation, I taught you the 5 cardinal signs of acute inflammation. So what are the 5 cardinal signs? The first one is the rubor, that is organ become red in color. That is the reason why the organ is red, because of vasodilation of the artery. The second one, after that, it is calor. The organ is more hot as compared to the surrounding tissue. The third one is dolor. So the person have pain in that organ. The fourth one, rubor, calor, dolor, tumor. The organ looks swelled. And the last one is functiolacia. So there is loss of function, temporary loss of function of that organ. So redness, increased temperature, increased pain, increased swelling, and loss of function. These are the 5 cardinal signs. I'm interested only in the first one, rubor. The reason for rubor in inflammation is this. It is the hyperemia, which is due to vasodilatation of the arteries. Now, whenever we have any emotional changes, we have blushing. What do you mean by blushing? Blushing is the flushing. The complete person looks red because of vasodilatation of the cutaneous blood vessel. So the skin blood vessel, especially the face is blushing. You may have seen that the face is blushing. During emotional, either the person is very happy or very sad. So during emotional changes, we have blushing of the face. What is blushing? It is vasodilatation of the cutaneous blood vessels of the face. So the face look erythromatous. It is looking red in color. This is another example of hyperemia. The third example of hyperemia is muscular exercise. Whenever we do extensive exercise, we turn red in color because of vasodilatation of arteries of complete complete body, and again in high grade fever. So these are the 4 examples of hyperemia. I'm not interested in teaching you hyperemia. Congestion is more important, which is there in your syllabus. What is congestion? On the other way around, congestion is due to impaired venous drainage. It is due to obstructed venous drainage. It is a passive process. Here the organ looks blue in color. That is known as cyanosis, because here the blood which is accumulated inside the organ is impure. Impure means deoxygenated blood. So I hope you got the differences between hyperemia and congestion. I hope everyone got it. I want thumbs up. I want thumbs up from you. So hyperemia is an active process. Congestion is a passive process. Hyperemia is due to vasodilatation of the artery. And congestion is due to impaired blood flow of the vein. So this one is active, this one is passive, right? Here oxygenated blood is gathered in the organ. That's why organ look red in color, which is known as erythema. Here deoxygenated blood, that is impure blood, is gathered in the oxygen, accumulated in the organ. That's why organ look blue in color, which is known as cyanosis. I hope the concept is crystal clear to you. We have seen few examples of hyperemia. Let me teach you congestion in detail. Right. So what John is saying, I'm a second prof student. Many topics like renal GIT are missing. Please upload complete pathology. So John, please tag me on the Telegram. John Abbas, I'm available on the Telegram. Whatever specific topic you are asking, I've taken complete pathology in the free lectures. Maybe you are not getting the links properly. Some of the lectures are available on Unacademy Learners app. So you have to install Unacademy Learners app, and they are free there. Like YouTube, those lectures are also free. I will provide you the link for all the topics you needed. The free links I will provide to you. You tag me on the Telegram. So ask for the specific topic links you want. So I will upload it, or I will provide the links to you. Right? Okay. Anyways, let me move ahead. Let me teach you congestion in detail. Now, congestion is of two types. What do you mean by congestion? I've already told you what is congestion. Listen. So this is the organ. This is the artery to that organ, and this is the vein of the organ. I'm talking about congestion. Now I'm interested in congestion. I will teach you congestion in detail. So in congestion, I have told you there is venous obstruction. So vein is obstructed, or venous, it is not obstructed. If it is not obstructed, the venous drainage is impaired. So drainage of the venous vein is impaired. So in this condition, now this is of two types. What are the two types here? It can be acute, it can be chronic. You tell me the two changes. If the vein is obstructed suddenly, what will happen? Acute means suddenly. If the vein is obstructed suddenly, so blood cannot come out and the organ will have edema. Edema and congestion will be there in the organ, right? So that is acute. But I am interested in teaching you chronic. So if vein is obstructed slowly and gradually, it is not sudden, it is very slow and very gradual. If it is obstructed slowly and gradually, so edema will not result. Edema will not result. Impure blood is not coming out. The impure blood is not coming out of the organ, and it can result in ischemia of the organ due to the accumulation of impure blood there. It results in hemorrhagic necrosis of the organ, right? Okay, I will tell you the details. So I'm interested in chronic congestion, not in acute congestion. So till now, what we have seen increased blood in an organ. If any organ have more blood, depending what is that blood. If the pure blood is there, if the organ is having more of pure blood, it is known as hyperemia. We have seen that. And if impure blood is get collected in the organ, it is known as congestion. So hyperemia is due to vasodilatation of the artery, and congestion is due to obstruction or impairment of venous drainage. Congestion is of two types. We have already seen congestion is of two types. Acute means sudden, and chronic means slowly. Chronic means slowly and gradually. I am interested in teaching you chronic congestion. So what is the full form? I am going to start CVC now. What is the full form of CVC? Chronic venous congestion. So I am not teaching you hyperemia. I have told you the definition and examples of hyperemia. I am not teaching you acute congestion. It is not in our syllabus. I have taught you what is it, but the details of chronic venous congestion is there. So it is chronic congestion. It is due to impairment of the vein. That's why known as chronic venous congestion. So there are two names given here: chronic venous congestion or chronic passive congestion. One and the same thing. Either you say chronic venous congestion, it is due to venous obstruction, and venous obstruction is passive. It is not active. That's why CVC and CPC is one and the same thing. Many students even don't know the full form of CVC. It is chronic venous congestion. I'm teaching you congestion, not hyperemia. We have already covered hyperemia, the definition and examples. Now I'm teaching you congestion, that is not acute one, the chronic one. So chronic venous congestion or chronic passive congestion, right? So listen, what is it? So I am teaching you not acute congestion, I am teaching you chronic congestion. Chronic venous congestion, that is my topic today. Now listen, for explaining you the chronic venous congestion of various organs, you should understand heart failure. Now everyone see this diagram. Can you see a diagram of heart? Yes, of course, you all can see the diagram of heart. You all can see the four chambers of the heart. Can you see the four chambers of the heart? Yes. Just a second. Let me see your chat. You all can see the four chambers of the heart. We will do the heart failure one by one. One by one, we will do right heart failure. We will do left heart failure. Let's do left heart failure first. So please do left heart failure. So in left heart failure, what is happening? The left ventricle is not contracting as usual. I have told you many times. So the blood is not going forward in the aorta since the left ventricle is not contracting. So blood will go backward. So blood will go from left ventricle to left auricle, from left auricle to pulmonary artery, and from pulmonary artery, the blood will go in the veins of the lung. So in the veins of the lung. So can I say this is impaired venous drainage? Impaired. The veins are not actually obstructed. There is no thrombus, there is no emboli, but the venous drainage is impaired. So there is increased amount of blood in the vein. So vein, so lungs vein. So lung have a artery is normal. But vein artery is giving blood to the lung. You can see the pulmonary artery is giving blood to the lung, but the vein is not carrying the impure blood because the vein is already full because of the backflow. The backflow, the vein is already full. So vein is not accepting the blood from the lung. So I am talking about the organ. The name of the organ is lung. See the artery of the lung, see the vein of the lung. So pulmonary artery is giving normal blood to the lung because there is no problem with the right heart. There is no problem. So pulmonary artery is giving normal blood. So artery is normal. There is no problem with the artery of the lung. But what about the vein of the lung? So vein of the lung is pulmonary vein. Pulmonary vein is not carrying the blood. Why? Because it is already full. It is already over. It is already full. Why? Because of the backflow. Because of the backflow, it is already full. So left ventricle is failed because left ventricle is not pumping. So backflow of the blood is taking place. And because of the backflow of the blood, that the pulmonary vein is already full. So what is the condition? Is it hyperemia or is it congestion? There is no problem with the artery, there is a problem with the vein, so of course it is a congestion. And it's a chronic thing, it is not acute. Left ventricle will not do sudden failure, so it is chronic failure. So it is chronic venous congestion of the lung. So in chronic venous congestion of the lung, when does it is happening? Chronic venous congestion of the lungs takes place in left heart failure. So whenever any person have left heart failure, because of which the person can have chronic venous congestion of the lung. Give me a thumbs up if you got it. Everyone give me a thumbs up if you got it. Now we will do right heart failure. Now see, right heart failure. What is happening in right heart failure? If right heart is not pumping, so you tell me the story, you already know the story. I have told you the story several times. So if right heart is not pumping, blood will not go ahead. So where the blood will go? Because right heart is not doing the systole, it is not doing the pumping. So where does the blood will go? Blood will go backward. From right ventricle, it will go to right auricle. From right auricle, it will go to SVC, IVC. SVC, IVC comes from all veins. So it is going in veins of all organs of the body. All organs of the body, the veins are full. The veins are over occupied. They are full because of the backup flow. Arteries of all organ are normal coming from the aorta. So consider any organ in the body, any organ. So this is any organ. Artery is normal because aorta is normal. It is carrying blood, but vein is not taking away the blood because vein is already full because of the backflow of the blood. So is it hyperemia or congestion? It is congestion because it is the problem of the vein, not the artery, right? So vein is impaired. It is not obstructed. You can say it is impaired venous drainage. It is not obstructed venous drainage. So it is impaired venous drainage. So it will result in CVC of all organs, but I will not teach you all organs. So right heart failure results in CVC of all organs, but I will teach you only two organs in detail, liver and spleen. So what is the summary? The summary is in front of you. The summary is in front of you. If the person have left heart failure, CVC of lung is the end result. If the person have right heart failure, CVC of all organ is the result, right? So in right heart failure, we have CVC of all organs of human body except lung. In left heart failure, person have CVC of only one organ, that is lung. So in our syllabus, I will teach you three organs, liver and spleen from the right heart failure and lungs from the left heart failure. Give me a thumbs up, everyone. So I am teaching you CVC, chronic venous congestion. So in left heart failure and in right heart failure, give me a thumbs up. In right heart failure, in left heart failure, we have CVC of lung, right? In right heart failure, we have CVC of all organs, but we will study only two, the liver and the spleen. Let me teach you three organs in this detail in the sequence: lung, liver, spleen. So let me teach you CVC of the three organs. Give me a thumbs up. Everyone give me a thumbs up. So let me start the CVC of the three organs, which is there in your syllabus. And consider one MCQ in your exam from this topic. It is an ultra important topic. Consider one MCQ in your exam from this topic, the CVC. So we have already read that CVC of lung results from left heart failure and CVC of liver, spleen and all other organs result from right heart failure. Now I request you to make this table with me. So CVC lung, CVC liver and CVC spleen. Please do a comparative analysis between the three. So in the end, you can do a rapid revision. So I am teaching you three CVCs now. You got it? You got it right. So in the introduction, write down the reason for them, then write the gross of each of them and draw the microscopy of each of them. So please everyone take a notebook, take a pen and start drawing this table with me. So I always ask you to draw, to make the table with me so that it fits in your permanent memory. You yourself are making it. So you don't require any extra time. During the class time only, you can make these tables and revise in that. So entire chapter you can revise just in 2 minutes if you are making this table. So I have already taught you that CVC lung results from left heart failure, but CVC liver and spleen results from right heart failure. We got the pathogenesis. You can draw the diagram of the heart, the four chambers of the heart here to explain why left heart failure results in CVC lung and why right heart failure results in CVC of all other organs of human body. I'm not drawing the flow chart here again, but in the introduction, you have to prove, you have to draw the flow chart and you have to prove why left heart failure results in CVC of lung and why right heart failure results in CVC of all other organs. So that is the introduction. The introduction part is already over. Give me a thumbs up. Everyone give me a thumbs up. Should I start the gross now? Let me start CVC lung. Gross and microscopy of CVC lung first I will finish. And then I will come on liver. Then I will come on spleen. Everyone give me a thumbs up. Everyone means everyone. Can you see me? Can you hear me? If you can see me and hear me and if you have understood the concept here, please give me a thumbs up. Please give me a thumbs up if you have understood the concept, right? So let me start the CVC lung. So CVC lung start करते हैं. CVC lung. CVC lung. The gross of the CVC lung. In the gross of the CVC lung, let me explain you, as I've already told you, it occurs in left heart failure. The grossly, if you see the lungs are heavy because it contains more blood. So these are heavy, these are congested, and they look bluish in color. Actually, they look brown in duration. I will tell you the reason for the brown in the end. So grossly learn the color, the brown in duration of the lung. Can you see the lungs are looking brown? So it is a diagram of CVC lung. CVC lung का gross है ये. So lungs are looking brown. I will tell you the reason for brown. Don't worry. Don't worry. Coming on the microscopy, if I cut it and make a slide of it, what is the slide? This is the slide. So first, before understanding this slide, do you know how normal lung look like? First, I will draw a slide of normal lung. So this is a slide of normal lung. In the normal lung, what do you have? What do you have in the normal lung? In the normal lung, we have alveoli. Alveoli, which are lined by alveolar cells. Alveolar cells are pneumocystes, type 1 and type 2 pneumocystes. You may be knowing pneumocystes. So these are the alveolar cells which are lining the various alveoli. So we have multiple alveolar cavities, alveoli, which are lined by the alveolar cells, right? Have you got it? So inside the lumen of each of them, we have air. So here air is present. For gaseous exchange, air, the air is present here. They are empty and they have air. So these are known as alveoli. Give me a thumbs up, number one. And number two, inside the lung, we have pulmonary capillaries. So these all are pulmonary capillaries. Everywhere they are present. These are the pulmonary capillaries. And the background is known as interstitium. The background, can you see the plain background? So pulmonary capillaries as well as alveoli, they are present in interstitium. The background is known as interstitium. Now, the blood is there in the capillary. These are pulmonary capillaries. Pulmonary capillaries. Now, blood is present inside them. Blood. Inside blood, we have carbon dioxide. And in the air, the fresh air, we have oxygen. So, gaseous exchange takes place here. So, air may say the oxygen goes in the blood, the pulmonary capillary blood, and from the blood, the carbon dioxide comes in the alveoli. So in this way, gaseous exchange is taking place here. That is the function of the lung. God has given the lung for this gaseous exchange. Everyone give me a thumbs up. Everyone gave me a thumbs up. Now, what I am doing? I am doing left heart failure. Imagine a condition, I am doing left heart failure. So in left heart failure, what is the condition? What is the condition? What is happening actually in left heart failure? So draw a diagram here and tell me this is the left heart. So if left heart failure is there, the left ventricle is not pumping. If left ventricle is not pumping, blood is not going in aorta. So where the blood is going? It is not going in aorta, no, it is going backward. We know it is going backward. So from left ventricle, it is going to left auricle. From left auricle, it is coming to pulmonary vein. It is coming to pulmonary vein. And from pulmonary vein, it is going to the lungs. Yes or no? It is going to the lungs. From pulmonary vein in the lungs, it is going to the pulmonary capillary. It is going to the pulmonary capillary. So what I mean, in left heart failure, can you see the backflow of the blood? Please appreciate what I want to say here. In left heart failure, imagine left heart failure, due to the backflow of the blood, there is more blood in these capillaries. So where are these capillaries in the slide? In the slide, where are the capillaries? So these are the capillaries. So can I say all these capillaries are more dilated as compared to normal in CVC lung? So I will change this normal diagram into CVC lung diagram. I will change this diagram into CVC lung. Currently, this is a normal diagram. Can you see a slide of the lung? It is absolutely normal. Currently, it is not having any pathology, right? Now, I will convert this slide into CVC lung slide. So, I will do the changes one by one. Please appreciate my efforts. Appreciate my efforts. Have you got it? So, I am doing left heart failure. So, in left heart failure, the left ventricle is failed. You can see in the diagram. So, blood is going backward. So, left ventricle to left auricle to pulmonary vein, from pulmonary vein to pulmonary capillaries. These are the pulmonary capillaries. So, where are the pulmonary capillaries in the slide? These all are pulmonary capillaries. They all will be dilated. So the first change, all pulmonary capillaries are dilated. Number one, give me a thumbs up. Due to the dilatation, the fluid will come out. Yesterday we have studied edema. If you have remembered, so more blood in the capillary, more water in the capillary, more hydrostatic pressure. So the fluid will come out and it will gather in the interstitial space. So please appreciate the interstitial space. The background I am drawing yellow color. So it is edema. It is edema. So all the background is having edema. That is the second change from the normal. It is not normal. Now I'm drawing the slide of CVC lung. In the CVC lung, first I have done the dilatation of the capillaries. So the capillaries got dilated. Number one. After dilatation, there is more blood in. Why they are dilated? Because of the backflow of the blood. You can see the left heart failure aside. So left heart failure ki wajah se the blood is coming backward, and because of the backward flow of the blood, there is more blood in the capillaries. So these are the pulmonary capillaries you can see in the lung. So in the diagram, they are dilated. So since they are dilated, there is more blood, more hydrostatic pressure, fluid is coming out, getting gathered in the interstitial space. So the first edema is interstitial edema. This edema is known as interstitial edema because edema is taking place in the interstitial space, the background space. This edema is known as interstitial edema. Give me a thumbs up. Give me a thumbs up. Still patient don't have any respiratory complaint because the air exchange is taking place. Air is present inside the lumen of the alveoli. It is normal. The lumen of the alveoli is still empty. The lumen of the alveoli is still containing air. It is empty. It doesn't have edema. Now, when the edema increases too much, can you see the yellow fluid? This edema increases too much. So from the interstitium, it will go inside the alveoli, and this edema get gathered inside the alveoli. Here in the space where normally air is present, instead of air, now water is present. They are full of water. Water means edema. So this edema is known as alveolar edema. This is stage 2. Alveolar. Now the person will have respiratory distress. Now the person will have respiratory problem. So the first thing, pulmonary capillary dilatation. The pulmonary capillaries are dilated. Due to dilatation of pulmonary capillaries, the fluid is coming out. The fluid is first gathering in the interstitium. The background is the interstitium. So it is known as interstitial edema. That is stage 1. That is stage 1. But currently the person don't have any respiratory distress. When edema, fluid is too much, so wo jayega kahan? From the capillaries, it is coming out, getting gathered in the interstitium. Now interstitium is full. There is no space in the interstitium. So it will enter in the alveoli. It will break the alveoli and enter inside the alveoli. It will fill the lumen of the alveoli. Now air cannot come inside. So patient can't breathe. Patient have respiratory distress, and this edema is known as alveolar edema. Give me a thumbs up. So first change is pulmonary capillary dilatation. Pulmonary capillary got dilated. Second, it will lead to interstitial edema. Third, it will lead to alveolar edema. Now the fourth thing, the last and the fourth thing. Everyone give me a thumbs up. These capillaries will rupture. These capillaries, the pulmonary capillaries, they are so dilated that they got rupture. Many of them got rupture. Now they have RBCs inside them. They have blood inside them. So RBC will come in the interstitium. The free RBC will come in the interstitium. When the capillary is rupturing, the free RBC is coming in the interstitium. RBC contain hemoglobin. Hemoglobin get converted into hemosiderin. Hemoglobin get converted into hemosiderin, which is present inside the free RBC. This hemosiderin will be engulfed. Now the lung have macrophages. Every organ have macrophages, right? So lung also have macrophages, yes or no? So these are the macrophages which engulf the hemosiderin. The hemosiderin is engulfed. So there are many macrophages. Let me draw a few macrophages. These macrophages are engulfing the hemosiderin, which is formed from the hemoglobin. From where hemoglobin is coming? It is from RBC. From where RBC is coming? The rupture of the capillary. Capillary rupture. RBC come out. From the RBC, hemoglobin come out. Hemoglobin get converted into hemosiderin, and hemosiderin is engulfed by macrophages. Such macrophages which have engulfed the hemosiderin laden macrophages, these are known as heart failure cells. So we can find heart failure cells. इस पे इतनी बार MCQ आ चुका है, repeat MCQ 100 times in your exams, previous year question. So what are heart failure cells? Now it is a misnomer. Heart failure cells are present in lung. This is a slide of lung. Heart failure cells are not present in heart. Heart failure cells are present in lung. These are present in lung when heart fails. Which heart? Left heart. When left heart failure is there, these cells come in the lung. That's why these are known as heart failure cells. What are heart failure cells? Heart failure cells are, in short, hemosiderin laden macrophages. Give me a thumbs up. Hemosiderin laden macrophages. Have you got it? Have you got it? So why hemoglobin converted to hemosiderin? So it is reduced. It is reduced. So whenever free hemoglobin is present, it is always converted to hemosiderin, right? So please see, whenever I will flip the slide, I cannot come on the slide again. It will be deleted. So please everyone notice the changes. Give me a thumbs up. Give me a thumbs up. So what all changes are there? Number 1, pulmonary capillaries are dilated. Number 2, interstitial edema. Number 3, that will convert into alveolar edema. And in the end, we have heart failure cells. First, everyone so this is the diagram given in your books. Can you see? Let me explain this diagram. Whatever I have drawn, it is the same diagram. So can you see the alveolar sac? These are the alveolus. Please appreciate the lining of the alveolus, the flattened lining. These are alveolar cells, pneumocytes. Please appreciate it is present in all. It is present. So these are the various alveolus you can see. Appreciate the alveolus. And between the alveolus, don't forget to appreciate the pulmonary capillaries. Let me draw few pulmonary capillaries. These all are pulmonary capillaries. Can you see? These are the pulmonary capillaries. Everyone give me a thumbs up. These all are. So what are the changes? Number one, pulmonary capillary dilatation. That is the first change, right? Second change, appreciate the background. Can you appreciate the background? The background is pink in color here. Can you appreciate the background? It is not empty, it is pink. This pink color is edema. So that is alveolar edema. So the second thing here is interstitial edema. Interstitial. Alveolar edema is not shown here. Or you can see in this one. ये वाले alveoli का background देखो. See the background of this alveoli. Can you see a light pink color here in the background? If you zoom it out, you can appreciate the light. So this one is alveolar edema. In rest of them, it is not present. Once it will rupture, the edema will go inside these also, and it will result in alveolar edema. The third thing. And the last, can you see all these cells I'm marking? See this cell, this cell, this cell. What are these? These all are macrophages. Can you see the nucleus of macrophages? They all have nucleus. In the cytoplasm, can you see the red dots? This red dot is hemosiderin. So all of them are hemosiderin laden macrophages. These are known as heart failure cells. So the last finding, but not least, is heart failure cells. Define heart failure cells. These are hemosiderin laden macrophages. So these are the 4 findings in CVC lung. Do you have any doubt in this? Pulmonary capillary dilatation, interstitial edema, alveolar edema, and heart failure cells. Everyone give me a thumbs up. So there is interstitial edema, after that alveolar edema, and then there is heart failure cells. Due to the heart failure cells, now hemoglobin is red in color. When it converts into hemosiderin, hemosiderin is brown in color. That's your brown induration in the gross. I have told you now. I will tell you the reason. I will tell you the reason for the brown induration. Why it is the brown color? So the reason for the brown color is the formation of hemosiderin inside the lung. So that is the reason for brown induration. Everyone give me a thumbs up. I am done with the lung. So please mind my words. Heart failure cells are not present in heart. They are present in lung. They are present in lung in case of left heart failure. That's why known as heart failure cells. And these are hemosiderin laden macrophages. Actually, these are macrophages who have eaten the hemosiderin. So hemosiderin laden macrophages. So let me draw a diagram. So heart failure cell is a cell with a nucleus. This is a macrophage. In the cytoplasm, you will find the hemosiderin. So this cell is known as heart failure cell. It is a macrophage who has engulfed the hemosiderin. I cannot simplify more than this. So I am done with CVC lung. Everyone give me a thumbs up. So you know the gross, you know the microscopy. Everyone give me a thumbs up. Should I come on CVC liver? Should I come on CVC liver? So please, you are making this table with me. CVC lung, CVC liver, and CVC spleen. You all are making this table with me. Say yes or no. Say yes or no. So in the introduction, you have already written that CVC lung occurs in right heart failure. Not right heart failure. I'm sorry, my mistake. It is left heart failure, and rest 2 are occurring in right heart failure, liver and spleen. So you can prove it. In the beginning of the lecture, I have proven how left heart failure results in CVC lung and how right heart failure results in CVC of other 2 organs and all organs of the body. In the introduction, you have to draw that flow chart and with the diagram. Coming on the gross and microscopy. Gross and microscopy. So in gross, write down one word. For the lung, write down brown induration of the lung. The lung will convert into brown color. Now you know the reason for brown induration of the lung. That is hemosiderin. Hemosiderin is present. That's why. In the microscopy, write down 4 points. 1, 2, 3, 4. Don't write. Draw the microscopy. It is always better to draw the microscopy instead of writing. So you will get your concepts crystal clear. The first thing, there is pulmonary capillary dilatation. Due to the dilatation of the capillary, the fluid will come out. The fluid will accumulate in the interstitial space, leading to interstitial edema. When the interstitial edema is too much, it will rupture the alveoli and enter inside the alveoli. It will result in alveolar edema, the third thing, right? So interstitial edema followed by alveolar edema. Now the pulmonary capillary will rupture. So RBC will come out. Hemoglobin will come out. Hemoglobin will convert into hemosiderin, and macrophage will engulf the hemosiderin. So heart failure cells are formed. So these are the 4 findings in the microscopy. I think everyone, the concepts are crystal clear. Let me start liver CVC, but liver CVC is very tough. We will do the gross and microscopy comparison here of liver and spleen, and in the end we will do a total comparison. Everyone give me a thumbs up first. It is not necessary that heart failure cells. Okay, so in this diagram, Z is asking why heart failure cells are present only inside the alveoli, not outside the alveoli in the interstitium? It is a good question. My answer is very simple, Z, that because macrophages are present inside the alveoli. Macrophages are not present in the interstitium. So macrophages are present only in the alveoli. So these capillaries, you can see the capillaries. You can see the capillaries. These are the pulmonary capillaries. When they will rupture, can you see the black? It is the pigment. So they rupture, RBC come out. The RBC will come out. It will liberate the hemoglobin, and that will enter inside the inside the alveolar capillaries. And inside the alveolar capillaries, macrophages are present. Those macrophages will engulf the hemosiderin, and heart failure cells are formed. Should I proceed ahead? Should I come on the liver? CVC liver. First, you have to give me a thumbs up. For understanding CVC liver, give me a thumbs up. Z, Rishinika, everyone, those who are watching me live. So to understand the CVC of liver, you should understand the histology of liver, without which I cannot explain you the changes in microscopy of the liver. So for that, I have to explain you the histology of the liver first. So let me explain you the normal histology of the liver. We know liver is the largest organ in human body. Liver have two lobes. So this is the right lobe of the liver. This is the left lobe of the liver. The two lobes of the liver are separated by falciparum ligament. So that is normal liver, right lobe, left lobe. We know that. So right lobe, left lobe. Right lobe is 6 times larger as compared to left lobe, right? And there are the ligaments which are separating the two lobes of the liver. So the two lobes of the liver are separated by 3 ligaments. If you talk about anteriorly, they are separated by falciparum ligament. If you talk about posteriorly, they are separated by ligamentum venosum. And if you talk about inferiorly, they are separated by ligamentum teres. So anteriorly falciparum, because this is the anterior view, it is falciparum ligament. The same liver from posteriorly, it is ligamentum venosum. And from inferiorly, yahan pe inferiorly, they are separated from ligamentum teres. So basically there are 3 ligaments which separate right and left lobe of the liver. They are separated by 3 ligaments. If you talk about anteriorly, it is falciparum ligament. If you talk about posteriorly, it is ligamentum venosum. And if you talk about inferiorly, it is ligamentum teres. So these are the MCQs you should know: anterior, posterior, inferior. The 3 ligaments separating the 2 lobes of the liver. Give me a thumbs up. Give me a thumbs up. After that, the entire liver is covered by a capsule known as Glisson's capsule. इस पे भी MCQ आता है, right? So Glisson's capsule is the capsule which is covering the entire liver. The name of the capsule is Glisson's capsule. We know that, right? We know that. Liver has dual blood supply. I'm not explaining you the dual blood supply. You already know, I guess. Everyone knows. Okay. For those who don't know, let me summarize. What is dual blood supply? To understand the Porter triad, you should understand the dual blood supply. Can you see a liver? Yes, you all can see a liver. You know, all organs of the body receive pure blood from aorta. Yes, so liver is one of the organ. So liver also receive pure blood from the aorta. See the heart. This is the left ventricle of the heart. Can you see the left ventricle of the heart? From the left ventricle of the heart, aorta is coming. Aorta is giving pure blood to the liver via hepatic artery. So the first supply is the hepatic artery, which contain pure blood to the liver. That is the first supply to the liver. So like all organ, it is also receiving pure blood from the aorta via artery. The name of the artery is hepatic artery. That's it. Okay. Now see, this is GIT. Can you see there is GIT? This is esophagus, this is stomach, and this is intestine. So this is complete GIT. Can you see the complete GIT? Yes. You all can see complete GIT. From GIT, veins arises. These veins, all these veins of the GIT go in the liver forming a portal vein. So portal vein is the second blood supply to the liver. So liver is receiving pure blood from the heart via hepatic artery. Liver is receiving impure blood from the GIT veins, that is portal vein. So the two blood supply to the liver is hepatic artery and portal vein. Two things are coming, they are mixing. So pure and impure blood mixing takes place inside the liver. Hepatic artery carrying pure blood, portal vein carrying impure blood. Both the blood will leave the liver via a vein. A third thing, they exit the liver via hepatic vein. Hepatic vein is known as central vein. Central vein is the another name of hepatic vein. So it is leaving the liver, and as all the veins drain in superior inferior vena cava in the right side of the heart, hepatic vein is also draining in right side of the heart via inferior vena cava, and it goes to the lungs for purification. Give me a thumbs up if you got this. So total I'm talking about 3 things. The 2 things are coming in the liver. One is hepatic artery coming from the aorta, one portal vein coming from GIT. Both are coming and one is leaving. One is leaving. What is leaving? Exiting. See the arrow. So exiting is hepatic vein. Everyone give me a thumbs up if you got it. Everyone give me a thumbs up. So these are the 3 things. Now why God has given us liver? Inside the liver we have cells. These are the cells of the liver. Let me draw few cells in the liver. These are hepatocytes. Hepatocytes synthesize bile. Inside each hepatocyte there is synthesis of bile. So this also synthesize bile, this also synthesize bile, this also synthesize. So all the hepatocytes synthesize bile in their cytoplasm. all the bile get collected and the bile exit the liver and go in the duodenum via bile duct. So bile is exiting from the liver, all the bile is get collected and it is exit from the liver via bile duct. Bile duct open in duodenum, the first part of the duodenum via ampulla of Vater. And this bile helps in digestion. We know helps in digestion of the fats. We know that emulsification of the fats, right? So the four arrows you can see. Can you see a liver? In the liver, two things are coming. What two things are coming? Can you please tell me what two things are coming in the liver? Hepatic artery is coming. See the arrow from the aorta carrying pure blood. Portal vein is coming from the GIT carrying impure blood. These two bloods getting mixed and leaving the liver. So leaving the liver, one of the exit arrow is hepatic vein or central vein going to the heart, right side of the heart, and one of the exit arrow is bile duct. These three contain blood and this contain bile. Give me a thumbs up. Everyone give me a thumbs up. Everyone give me a thumbs up. Out of these four, so let me draw a liver in a separate page. You have to understand this if you want to understand CBC liver crystal clear. This is liver. So in this liver, I will draw hepatic artery. See the arrow. This is hepatic artery. The blood is coming here. This is hepatic artery. This is portal vein. This is portal vein coming from the GIT. The blood is coming. So both the arrows, they are coming towards the liver. They are coming towards the liver. Let me draw a vein. That is hepatic vein. Hepatic vein that exit the liver, go in the heart for purification, right? So these two artery, one vein, they carry blood. And the fourth one is the bile duct. Fourth one is the bile duct. So all the bile synthesized inside all cells of the liver exit the liver and go into the duodenum. Go into the duodenum via bile duct. See, two arrows are coming, two are leaving. Out of these four, the three are the best friend. The three are the best friend. Who three are the best friend? The best friends are hepatic artery, portal vein, and bile duct. These three are best friends. They are best friends. They always travel together. So what is the surface of the liver? See the surface of the liver. Can you see? This is these three constitute portal triad. पोर्टल ट्रायड में चार में से तीन ही लोग हैं. चौथी चीज कौन नहीं है, which is not there in portal triad? It is hepatic vein. Hepatic vein is not there in the portal triad. Can you see the surface of the liver? On the surface of the liver, please appreciate, this is hepatic artery, the red one. It is entering the liver. It is portal vein. It is also entering the liver. And this is bile duct. It is coming out of the liver. But the point of entry and exit is same. This point is known as hilum. Hilum in the liver. So on the hilum, the two things are entering and one is coming out. So hepatic artery is entering, portal vein is entering. That is a dual blood supply. Dual blood supply of the liver. One is pure blood from the aorta, one is impure blood from the GIT. That is the dual blood supply is entering inside the liver. And bile duct is coming out. These three are best friends because they are together. At the hilum, these three are stick to each other. They are together. Not only they, if you see, the two things are going inside the liver. Hepatic artery will divide into the arteries. The hepatic arteries. Portal vein will also divide into the branches. Hepatic artery also divides into the branches. Portal vein, after going inside the liver, both divided into their branches. Hepatic artery forms its own branches. Portal vein is forming its own branches. And what about bile duct? Bile duct is formed by multiple branches. Multiple branches from all hepatocytes are coming and they are combining together to form bile duct. Not only the main hepatic artery, portal vein and bile duct travel together, their branches also travel together. That is my point. See this diagram. Can you see this diagram? Their branches are also, so it is a triad which is always traveling together. The three things always travel together. The three best friends, you cannot separate them. Hepatic artery, portal vein and bile duct. These three always travel together. It is known as portal triad. That's why known as triad. It is a tripod. You cannot separate them. Not only these, their branches always also travel together. Give me a thumbs up. So a branch of hepatic artery, a branch of portal vein and a branch of bile duct. It constitute portal triad. I hope you got the concept of the portal triad. Give me a thumbs up. Everyone give me a thumbs up. So let me teach you the lobular model of the liver now. Okay, it is difficult. Huh? I am warning you it is difficult. If you lobular model, what do you mean by lobular model? Lobule is a hexagon. Can you see it is a hexagon with the 6 corners? So if this is a liver, can you see the liver? If you cut the liver and make a slide of it, you see the entire liver have multiple hexagons. So the entire liver is like this. It is having multiple hexagons. It is known as lobule, lobular model of the liver. So in the entire liver, we have multiple hexagons like this, right? We have multiple, the entire liver is divided into hexagon. So what is present at the center? Let me draw one hexagon separately. I will show you. So can you see multiple hexagons? This is one of the hexagon. This is another hexagon. So entire liver is divided into hexagon. This is one of the hexagon. At the center of the hexagon, you have central vein. What is central vein? Which is not coming in portal triad. That is hepatic vein. Now you got the reason why hepatic vein is known as central vein. I have told you na कि I will tell you the reason hepatic को central क्यों कहते हैं, because it is present at the center of the hexagon. That's why it is known as central vein. And at the periphery you have portal triads. So see this liver, see this liver. I have told you four things. Now where is the liver? Where is the liver in this diagram? This is the liver in this diagram. In this liver, can you see the four things? Two are coming, two are leaving. Out of the four, three are portal triad. So if you cut the liver, let me draw it, right? So this is the hexagonal model. Let me draw few hexagons here. I cannot draw all, but let me draw few hexagons. So these are the few hexagons. So out of these four, which is present at the center of each, this hepatic or central vein is present at the center of each. Give me a thumbs up. Give me a thumbs up. So this hepatic or central vein is present at the center of each. The branch of hepatic or central vein. Give me a thumbs up. And what is present at the periphery? What is present at the periphery? What is present at the periphery? At the periphery, the triads are present. At all six peripheries. At all six peripheries, the triads are present. In each triad, three things are present. Hepatic artery, portal vein, and bile duct. They are present at the periphery. Give me a thumbs up. I tried hard. No one will explain you with such clarity. Give me a thumbs up. Everyone give me a thumbs up. So can you see a beautiful diagram I have drawn for you? Now I will tell you CVC liver. Let me come on CVC liver for you. So can you see a beautiful diagram? It is one of the lobule. It is one of the lobule of lobular model of the liver. It is one of the hexagon. Can you see the center? At the center, what is it? Can anyone name it? What is it? Rishinika, Zed, anyone else who is watching it? What is it? John, what is it? So it is hepatic vein, also known as central vein. What is present at the periphery? At the periphery, we have portal triads. What is the composition of portal triad? Portal triad have three things. This is hepatic artery, the red one. This is portal vein, the blue one, and this is bile duct, the green one. So that is portal triad. So we have six portal triad and one central vein. One central vein. So this is a hexagonal model. You got it? You got it? Now one more thing. Now the central vein is connected with the portal triads with hepatocytes. Can you see the yellow color cells? These yellow color cells are known as hepatocytes. These are the cells of the liver. These are hepatocytes. Can you see? So hepatocytes are there. They are connecting. Now between two adjacent, these are like train. The bogies of a train, they are one behind the other. They form rows. Rows का मतलब होता है trabeculi. These are known as trabeculi. Like the bogies of a train. They are one behind the other. Like one behind the other, they are the bogies of the train. Between two adjacent trains, there is a blood capillary. Can you see? So let me draw two trains. So this is one row of the hepatocyte, one trabeculi. This is another row of the hepatocyte, another trabeculi. Between two adjacent trabeculi, we have a capillary. It is known as sinusoid. This capillary is known as sinusoid. So sinusoids are present there. Number one, right? This is the sinusoid. In the sinusoid, it is lined by endothelial cell. Ikka dukka cell, you will get macrophages also. The macrophages are also present there. Let me draw few macrophages here. These are known as Kupffer cell. So endothelial cell and Kupffer cell are present in the sinusoid, and sinusoid is present between two adjacent trabeculi. Right? Give me a thumbs up. Give me a thumbs up. There is a space. The space between the trabeculi and the sinusoid. This space. I'm talking about this space. This space is known as space of Dissay. This space is known as space of Dissay. Space of Dissay. It contains a special cell. The name of the cell is Ito cell. This space contains a cell. It is known as Ito cell. This cell is most important for causing cirrhosis in the liver. While the hepatocytes have injury, these hepatocytes have injury due to any reason, due to alcohol, due to iron, due to copper, any reason. Ito cell convert into stellate cell and it start forming collagen, and that collagen will result in cirrhosis. ठीक है, ये तो बहुत detail हो गया. Leave it, don't worry. So that is the thing I want to tell you here. Okay. One more thing. Can you see the bogies? These are the bogies. That is hepatocytes arranged in row. Now the two adjacent hepatocytes, between two adjacent hepatocytes, there is a pore. They are connected with each other. Have you traveled in a train? You may have. So the two bogies of a train are connected from inside on a broad line. You may have seen it. You can travel from one bogie to another in a running train from interconnected channel between two bogies. So in the same way, the two bogies are connected with the help of the pore. Why God has given these pores? As I have told you, what is the function of these hepatocytes? All these hepatocytes synthesize bile. So the bile synthesized in this is transferred to this. The bile synthesized in this is transferred to this. The bile synthesized in this is transferred to this. In the same way, all the bile got collected in bile duct. This bile duct collect the bile from all the, and all these bile ducts connect together and form the main bile duct. Everyone give me a thumbs up. Everyone, I tried hard. Right. So you got the meaning. So let me come on CVC liver now. That is my topic. That is my topic. Now you will understand it. So where is the, just a second. No, no. Do the right heart failure. Do the right heart failure. What will happen? Everyone do the right heart failure. Fatafat karo right heart failure. If you are doing right heart failure, where the blood will go? CVC liver results in right heart failure, no? Right heart failure results in CVC liver, no? So right heart failure, right ventricle is not pumping. Blood is not going here ahead in the pulmonary artery. It will go backward. From right ventricle, blood will go in right auricle. From right auricle, the blood will go in SVC, IVC. From SVC, IVC, the blood, now this organ is liver. Consider it as liver. The blood will go where? Liver में तीन चीजें हैं, hepatic artery, portal vein, hepatic artery, portal vein, central vein, and bile duct. चार चीजें हैं. So due to the backflow of the blood, where the blood is coming, I'm asking to you, Rishinika, Z, others who are asking to, who are listening to me, please give your answer. In the liver, I have told you there are three blood vessels, now hepatic artery, portal vein, which are the part of portal triad, right? And the third is hepatic vein. Bile duct don't have blood, it is having bile. So blood containing तीन ही चीजें हैं, तीन channels are blood containing. So out of the three, due to the right heart failure, due to the backflow of the blood is accumulated in which of them? Blood is accumulated in hepatic artery or portal vein or hepatic vein. Common sense. Common sense. Yes, Rishinika, Z, you are absolutely right. So it is in hepatic vein. So it is the hepatic vein which drains in SVC, IVC. And because of the backflow of the blood, more of the blood is collected in hepatic vein. Very good. Now remember this, I will show you the diagram. Right? You got this point. You got this point. Now let me show you the gross of the CVC liver. In gross, learn the term nutmeg. Does anyone know the Hindi name of nutmeg? Nutmeg is a eatable. It is present in your kitchen. Indian kitchen it is present. What does it mean? हिंदी में क्या कहते हैं nutmeg को? Does anyone know what is nutmeg? I'm asking to you, what is nutmeg? Anyone knows? Nutmeg is known as jaifal in Hindi. Have you ever seen jaifal in your kitchen? You may have. It looks like this. It looks like this. So it looks like supari. It is not supari. Actually, why the liver is known as jaifal? Why? What is the connection between the liver and nutmeg? This is nutmeg. So can you see alternate red, yellow, red, yellow, red, yellow bands here? So in CVC liver also the liver is like this. So can you see alternate red, alternate red, yellow, red, yellow, red, yellow. So it is looking like nutmeg. Can you see alternate red, yellow? So that's why the liver is known as nutmeg appearance. I will tell you the reason for red also. I will tell you the reason for yellow also. Don't worry. So this is nutmeg. This is nutmeg. Have you got it? Now if you cut this liver and make a slide, this is the slide. You will say, ma'am, what is there in the slide? Okay. See, this is the hepatic vein, the central vein, and this is the portal triad. I'm drawing one central vein and one portal triad. So in the lobule, we have one central vein and we have 6 portal triads. These are the 6 portal triads. I'm not drawing all 6. I'm drawing one central vein and one portal triad. I'm drawing one, right? Right. So can you see this is the central vein and this is the portal triad. Now you tell me, in right heart failure, which one will be the dilated? Due to the backflow of the blood. In right heart failure, the blood is going backward, no? So it is going backward. So it is dilating the hepatic vein. So can you see the hepatic vein is dilated, it is ruptured and blood is coming out of it. Can you appreciate the blood coming out of it? The blood coming out of it. Can you appreciate? These three are normal. These three are normal. There is no change in this. Give me a thumbs up. Come on. So the hepatic vein is dilated. It is ruptured. Blood came out of it and the portal triad is normal. Now there are some hepatocytes. There are some hepatocytes which are near. These hepatocytes are near central vein and these are the hepatocytes which are near portal triad. A row of hepatocytes are connecting them, right? So the hepatocytes which are near central vein, so because the blood is coming out, it is impure blood, that will cause necrosis of these hepatocytes. So these hepatocytes look red in color. So that is known as because of hemorrhagic necrosis. Hemorrhagic necrosis, they look red in color. And the hepatocytes which are near portal triad, can you appreciate fatty change inside them? Can you see the yellow fat inside them? So this is the fatty change inside them. So they look yellow in color. So that is the alternate red and yellow which is giving you nutmeg appearance. That is the nutmeg appearance, right? Let me draw few lobules for you. In these few lobules, this is the central vein in each of them and these are the portal triads in each of them. These are the portal triads. I'm not drawing all, but yeah, you understood. They contain three things inside them, right? Now what I am saying, the hepatocytes near the central vein, they undergo red color because of hemorrhagic necrosis, because this one is rupturing. and impure blood is coming out, causing the necrosis, hemorrhagic necrosis of these hepatocytes. And the hepatocytes which are near portal triad, these hepatocytes, they are yellow in color because of the fatty change. Tell me the reason. Tell me the reason for red color. Tell me the reason for yellow color. So red color is the hepatocytes which are around central vein. They are red in color because of hemorrhagic necrosis. And yellow is the color which is to the hepatocytes near portal triad. They are yellow color because of fatty change. So alternate red yellow gives nutmeg appearance. Alternate red yellow gives nutmeg appearance. I cannot simplify more than. So that is the summary. Have you got it? So I am done with CVC lung. I am done with CVC liver. I have to stop right now because I am having a plus class after 3 minutes. So thank you very much for being with me. I really enjoyed teaching you. Hopefully same from your side. Few announcements for you. The next lecture I will take after the plus class. After 2 o'clock or 3 o'clock in the afternoon, I will take the next lecture. If you like the lecture, don't forget to click on like button before leaving the lecture. Share the link with your friends, colleagues. Subscribe our YouTube channel, Unacademy Future Doctors and Let's Crack NEET PG, and press the bell icon for future notifications. So if you take the Unacademy subscription, new offerings, what we are offering to you. We are offering few new offerings to you. You take the subscription now. Previous year questions are available on the app for practice, right? Doubt clarification batch is launched, so you can ask your any doubt to and any of the 19 subject to your educators. We will answer your doubts, right? And after every plus class, we will give you a bunch of 5 to 10 questions for practice, so that topic by topic your topic will become strong, that becomes strengthened, right? So these are the new things. The biggest announcement is that today is the last day of the sale, the biggest sale of the year. So if you take the subscription today, any subscription, plus or iconic, any plan, 2 months, 6 months, any plan, instead of 10% discount, you will get 20% discount only today. Otherwise, you will get 10% discount. If you apply my code, you can get this offer. So before payment, apply my code. My code is Sachdev10, SACHDEV, Sachdev10 is the code. Thank you very much. Once you take the subscription, you will be eligible for all these batches. In plus subscription, you will get only Unacademy access. In iconic, along with Unacademy, you will get preparator access also. And thank you very much for being with me. Okay, so yes, definitely hemoptysis occurs in lung in later stages, right? So thank you very much. I will continue the lecture in the afternoon. In the afternoon, I'm going to teach you few important topics from neoplasia. Thank you. Bye bye, on YouTube only. But on Let's Crack NEET PG YouTube channel of Unacademy. Bye bye. Study hard.